9:19 is the time. It's Wake Up Wyoming. My name is Glenn Woods. Thanks for joining me, and thanks to Nick from the news department sitting right across from me as we go through this long cast of characters from every possible industry we could think of. So CEO and president of Cheyenne Regional Medical Health System and Medical Center, Tim Thornell, will be with us. Also CEO of Envision Memorial Hospital, Doug Foss, and Senior Vice President of Medical Operations and Chief Clinical Officer, Dr. James Bleicher, is with us as well. And I wanted to start with Dr. Bleicher with a real quick question. Let's take a look at hospitals around the state of Wyoming. If I were to go to the hospital now for anything, not coronavirus, have you had to change the way you do business? What does that look like today?
Well, good morning. And, the changes are everybody's wearing masks now. That's really the biggest change. Otherwise, you come to the hospital, it's pretty much the same. If you don't have COVID, we ask you some questions related to COVID because we want to have a good idea if you might have it or not, because then you would be treated differently. But if you don't have any symptoms or signs or exposure, other than we have you wear a mask, it'd be pretty much business as usual.
And Mr. Foss, Mr. Thornell, is it about the same for each of you?
Yeah, this is Doug over at Ivinson. Yeah, it is very similar to that. I would say the things that will look different also is the spacing. As patients come in, you'll see patients spread throughout the organization instead of having them in waiting rooms. So our cleaning procedures we've always been a clean facility, but we've really enhanced the cleaning to make sure between every patient and every exam room, there's a top to bottom cleaning of each room.
Mr. Thornell, are you seeing more people or fewer people because of this?
Oh, we're absolutely seeing fewer people. Our volumes are down all across the hospital. Some intentional, some unintentional. Certainly, we made the intentional decision, along with just virtually every other hospital, to not perform elective surgeries at this point in time. But unintentional, our ER volumes are down. There is a little bit of concern that some people are fearful of going into the hospital, into the ER, even when they do have an emergent situation. So we are all safe and ready and available to take care of emergent conditions. So we are a little concerned about patients not seeking care when we believe they may need it.
And Mr. Foss, we've heard a bunch about the financial impact to rural hospitals in particular, and you talk about Wyoming, and that's just about every hospital in the state, I suppose. So, what has that financial impact looked like at Ivinson Memorial?
Yeah, it's been a significant financial impact. Our revenues are down by over half, and thankfully we entered this with being a very strong financial organization. So we will weather this and come out the other side. I'm afraid other organizations in the United States aren't going to be as lucky. But we've seen revenue cut significantly, and a lot of hospitals have adjusted their operations, laying people off and cutting back on a lot of things. And we haven't done that mostly because we know we will come out the other side, and we need our employees when we exit the other side. So we've kept our employees on and have paid them, and likely as this comes forward, we will be ready to go right back up to operation.
Mr. Thornell, maybe you could address that next.
Yeah, it's certainly impacted us financially, like it has negatively impacted virtually every hospital in the country and certainly within the state. Similar to Ivinson, we're in a fairly good financial shape to be able to weather the storm. But make no mistake, it is a storm that we're going through along with everyone else, and clearly has financial impact on us. Our volumes and therefore revenue are down anywhere from 30% to 60% in different departments. For us to get through this, we're certainly tapping into our reserves, which really means we have to redirect funds that we were going to attribute to capital projects. And so we're diverting millions of dollars from that and just having to delay for probably a year some of our capital projects we really want to get done. So we'll do them. It'll just set us back a good year or so.
And any impacts to your staff there?
To our staff, similarly to Ivinson, we've been very fortunate to not have to implement layoffs or furloughs. Certainly in some particular areas in outpatient arenas where we're seeing a reduced amount of patients, some of our staff aren't getting as many hours as they would have normally. We do have a few new jobs that never existed before, like screening employees and patients as they come in.
Sure.
So a lot of our staff are getting some hours in that fashion. So again, we've been fortunate so far to not have to have drastic measures on the employee staffing side.
And Dr. Bleicher, same situation at Wyoming Medical Center, I assume. And I had heard, if I am not mistaken here, that the administration took some pay cuts there to kind of help ease the burden.
Yep, that's true. And similar to the other hospitals, we were strong going in and happened to use our reserves. Our revenue and admissions are down 30%, and the administrative management staff did take a 20% cut for April and now also for May. We have not furloughed or laid anybody off, reduced work level for many areas, as the other CEOs mentioned, and non-clinical staff we've reduced to match the clinical staff, which isn't getting enough hours, that they also only work 4 out of 5 days to help ease the impact.
And it sounds like generally things are tenable at this point for each of your hospitals. But Dr. Bleicher, I'll start with you. How far along does this go? How long does this kind of operation, this alteration, continue before you reach a new level of pain financially?
Well, we hope we don't reach that new level. The post-COVID time now, or plateau, or the new normal as we're calling it. We're going to continue to see COVID patients. They're going to continue to exist in our hospitals, and we're going to start to bring back the elective procedures. And, we expect over the next 4 to 6 months to get back to where we were prior to this, which would be about the time that they're predicting a possible surge with flu and COVID in the fall, early winter.
And Mr. Thornell, how long are you equipped to weather this kind of storm?
Yes, certainly. I know financially we can weather this storm. Probably a couple more months as it stands today, but we do expect things to start improving here within the next 3 or 4 weeks. So that'll help alleviate that burden and concern. But I think, like most hospitals, we realize we can lose a lot of money really quickly, and so it was pretty interesting to see how much impact this could have so abruptly, so quickly.
And talking about losing so much revenue so quickly, what has been the biggest drain? Is it elective procedures going away? Is it the decrease in ER visits?
Yeah, it's certainly a combination of all those. Elective surgical procedures is a big part of what most hospitals do, and certainly a part of the revenue component. ER visits plummeting, and just a lot of outpatient ancillary services, lab procedures, radiology procedures, all those things really add up very quickly.
And Mr. Foss, I know you mentioned Ivinson financially is in pretty good shape. Have you received or do you have options for, should you need it, financial assistance from either the state or the federal government?
Yeah, there have been a few options put forward by the federal government. One of the options that actually they just sent money to every hospital in the United States in proportion to your size. So we did receive a small amount of money through that. We haven't looked to get other funds. However, we have we're banking on ourselves because we've been financially successful. So, one thing I would point out, Tim had mentioned, these elective procedures. The word elective is a little bit of a misnomer because a lot of people need these procedures. These are things they're putting off, but these are hip replacement, knee replacements. They might be removing a gallbladder or some other cases that people really do need. So it's not cosmetic surgery that we're holding up. It's actually really important work.
Yeah, not to confuse the word elective with unnecessary, certainly. And Dr. Bleicher, we'll finish with you here. I mean, I know Wyoming Medical Center in particular, but I believe, as I understand it, Cheyenne and Laramie, they've also benefited from folks in the community making masks, showing other kinds of support. I'm sure that everybody who lives here and in Cheyenne and Laramie would like to know how they can support their hospitals continuing. So what do you need going forward?
Oh, I think making the mask has been excellent. We have thousands of cloth masks now. There have been multiple deliveries of meals to the staff, which has been excellent. I think I speak for everyone. I say, hey, if you're sick or you have a problem or you need something, please don't defer it and see your healthcare provider so we can get it taken care of. There's nothing to be scared of to come to the hospital. As the other ones mentioned, we're cleaner than we've ever been. And you have no risk to come in and get taken care of what you need to get taken care of.
All right, gentlemen, thank you for coming on. I appreciate your time.
Thank you all.
I appreciate it.
Thank you.
Thank you.